Earlier this month, we took you to an often neglected corner of America, now experiencing the highest rate of deadly infection per capita in the country. And now we return to the Navajo Nation for an update on how the community is grappling with the virus. With rampant poverty and lack of infrastructure, fighting COVID has been an immense challenge. It's also been the site of another heartbreaking family tragedy. Our Matt Gutman brings us their story.
Before COVID ripped apart her family of 11, Dorothy Scott had lived in this traditional Navajo hut. She shuffled toward it, but couldn't bear to go inside.
What goes through your mind when you're standing at your son's grave and you hear that your husband has just passed away, all from COVID?
And I was talking to my son right here at his grave, and I got a call, and I just stand there. I couldn't move, or I was like, what's going on? It's my husband. I know he was okay when I left. He's the one that telling me to go to the funeral. Yeah, and then say he's going to be here. He didn't say he was going to leave.
In all, 8 family members tested positive. Dorothy and several others were hospitalized. And then her son, Bobby Jr., died. Then her husband, Bobby Sr., died a couple of days later. We accompanied them on their first time back home. The puppies yapped, the grandkids gleefully playing on that rope swing. But for Dorothy, the place felt haunted.
And now we're at the hook on, but just looking at it, it's sad. What happened in there?
You lost everything.
Yeah. Look like my husband's still in there.
His spirit, she meant. They'd been married nearly 45 years. As it is for so many, their traditional Navajo hogan had no water or electricity. They slept heaped on those couches, and Dorothy's daughter, Darcy, went inside, trying to salvage something. There wasn't much to take. The sprawling Navajo Nation spans parts of Arizona, New Mexico, and Utah. The infection rate here in the Navajo Nation is higher than in New York, and the area's biggest hospital at capacity for weeks now. From what we're hearing, this could be called the epicenter of COVID in the country right now.
Yes, you're totally right. We currently have a higher rate per capita than any state in the United States.
And those not sick enough for the hospital are sent to 4 motels converted into respiratory clinics here in Gallup, New Mexico. And when those filled up, a gym was converted into a clinic.
Good morning, my dear. How are you?
Dr. Eileen Ulku has been treating the Scotts at this motel for nearly 2 weeks.
How have you been feeling?
I'm feeling good.
Okay. If you had told me 3 weeks ago that I would be starting elderly patients in a room by themselves without family members supporting them on oxygen and keeping them in a motel, closed up in a room, I would never have believed it. But these are the kinds of things that we're doing to try to keep as many people safe and healing and getting better as possible.
But there are many families like the Scotts here.
We do have multi-generational homes here, but you have that throughout the world. There are several benefits for that. It provides social support for the families. One of the biggest benefits, I think, in addition to that, is passing down the cultural knowledge. It's unfortunately, in this case, the way that the disease is spreading, it's hindering our ability to isolate individuals so that these incidence and prevalence rates can decrease.
One of the things that we've seen is, in some ways, the Navajo culture, and what makes it strong is working against it. These big families living in the same hogan, the same house, it's getting a lot of people infected. Have you seen a lot of that?
Yeah, we actually have identified pockets. Our public health nurses have been out and about in the community, and they're literally able to track, where you have one contact that's positive, you literally can almost guarantee the whole household is infected as well, too.
A reality exacerbated by poverty and a critical lack of infrastructure. The Navajo Nation is larger than West Virginia, but 40% of the people who live here don't have electricity, and 30% don't have access to running water, which is why they need to pump water at wells like this. So in the meantime, families like the Scotts stay confined in those motel rooms. When we first met them a day earlier, Dorothy's daughter Darcy had been separated from some of her 4 boys for almost a week.
Especially not seeing them, and I'm really close and with my mom, and I'm always with her, and especially we're going through this, and we have nobody to talk to, and it gets really lonely.
And during that brief visit, they got to hold each other again, because right now, it's all they have.
So much more meaning in a hug these days, and our Matt Gutman joins us now. Matt, so disheartening to see things get worse since the last time that you were there. After meeting with people of the Navajo Nation, do you get the sense that things may ultimately improve, not just in the fight against COVID, but with the problems of daily life that you mentioned that existed well before the pandemic?
It's been centuries of neglect. The U.S. government hasn't always been the best to the Navajo Nation. There have been many broken promises and treaties, according to the Navajo. Right now, they are working on trying to get that CARES money in and apply to all sorts of infrastructure projects, which could help with sanitation and water and power. But people also need help right now. So the question is, in the Navajo Nation, who gets the money? How does it get allocated? And who needs the help the most right now? Lindsay.
All right, Matt Gutman, thanks so much for your reporting.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.